Welcome back to Taiwan Outlook. Joining us today is Dr. Peter Chang, Director General of the Bureau of International Cooperation at the Ministry of Health. Dr. Chang, we've been talking about Taiwan's absence from the WHO, but Taiwan has been contributing to the public health facilities and health to other countries as well. Could you tell us a little bit about Taiwan's contribution in this regard?
We also already mentioned that in early 70s, Taiwan already have pretty much satisfactory established for our public health system. And we start to getting more sophisticated, trying a lot of good examples. So we have national health insurance since 1995, which is one of the unique experience within the global nations, member state. And in 1990s, with this such a long development, there was a doctor and a hospital nurses already think about we can offer something to the others. So I believe Tzu Chi Foundation, Taiwan Roots, and many of the World Vision branch in Taiwan, they start to have some doctor and nurses using their spare time to go abroad, traveling abroad free, voluntary, to help many, many of the countries. And after this about 10 years pilot experience, the government was looking at, gee, this is fantastic. You know, you don't go abroad just for traveling or for some kind of leisure. You really do something useful for others. And there was a very, very positive feedback coming from many, many of the countries. So in 2006, after several years, we discussed with all the medical community and hospital and charity foundation that we should form a new pattern of the global health assistance programs. And in February 2006, we formed it. We call it Taiwan IHA, Taiwan International Health Action. And that is the new body of the global health player that we were trying to combine all the public and private sectors together. And we have 560 hospitals in Taiwan at least and today. And there are many, many people in medical health profession. They are willing to do something out of their institution. So we were very lucky to organize this to help them go somewhere to do some medical assistance to wherever there was a need.
But as we know, other countries are also doing the similar things. But what are the comparative advantages that Taiwan enjoys in terms of providing this kind of assistance to other countries?
Okay, I think voluntarism is one of the unique big support for Taiwan, because I mentioned that many of the doctors and nurses from hospital, they didn't take vacation. They took vacation overseas to helping the others. They took it as an honor. They took it as a joy. Not some kind of obligation they need to do. And I think this voluntarism was generated from Taiwan's being a very self-sustainable autonomy. We are not in WHO. We are not bound to any of this ridiculous regulation by WHO. We are willing to do something out of our own capacity. So this voluntarism was generated from the NGO, many of NPO in Taiwan, and the government was only helping them, push them forward. So I think we are not a huge operation like many of the big countries, but I think this voluntarism and flexibility in terms of their operation will be one of the unique characteristics of our global health operation.
Is there any area of expertise that we are very good at, in terms of public health or medical fields?
Okay. I think the technology in Taiwan in terms of healthcare already fully developed. And when we look at the need in many of the developing countries, they are not short of the money. They are not short of attention. They are short of people really want to do grassroots work. So I can give you one example is that the most successful experience is in Malawi. In 1990s, we start to establish a hospital in northern part of Malawi. Within that within those 100-kilometer radius, there was no hospital at all. And Taiwan's government was very kind to establish the first hospital. Then we have a hospital moving a dozen of doctors, nurses, and anesthesia, pharmacists, all the way to stay that. And it's 400 kilometers north of the capital. It's somewhere of no one. But that area, the hospital can serve more than 2 million of people, or Malawian people.
Yeah.
And one of the unique things is that there are very, very few medical personnel already existing there. Yeah. So we have to use our technology. And one successful experience is using the fingerprinting method for registration of the patient. Okay. And they want to help people with HIV. And HIV people will come back continuously. But in Malawi, you don't have a registration system. So our people, IT people, designed one of the most unique example with one touch, and the people can be followed up continuously. And I see there was around 10,000 patients already with more than 1 year follow-up in northern part of Malawi. When I expressed this experience to many of the global health leaders, they couldn't believe that. Yeah. Because we didn't spend a huge amount of money. We just used our unique experience in that case.
Are we doing all those things by ourselves, or are we cooperating with other countries as well?
Well, I think in the beginning we are working with Malawi, certainly, in the case of Malawi. And day and night later, the development of the program already come out. So there was an international agency, want to donate, want to support our program. So I think Malawi's experience is multilaterals. Start with between Malawi and Taiwan. But many, many countries would like to see that program go into all the Malawi and even go to other countries in Swaziland, in Lesotho, in South Africa. And I think we are very generous. Yeah. We offer that experience to many of the partners. So yes, we like to go bilateral, but we also like to go multilateral, and it's already a successful example. So
are we sending those teams to only countries with whom we have diplomatic ties, or are we sending to even to countries we don't have diplomatic ties with?
Yeah. Well, you are a professor of politics, but well, in public health, we don't see borders. Yeah. We see everywhere. When there was a need, we go there, as long as we can support. And so we don't look at political factor as a decision before we make that. We always say that if you are a doctor, you see the patient, you don't ask what religious or what parties you belong to. We always help them solve their problem first. So we don't see the border between politics. We see the need. And we want to do as much as we could.
You mentioned that there are many volunteers now inside Taiwan who are willing to share their experiences and who are willing to help other countries. Do you think there's a growing awareness in Taiwan society about this kind of foreign medical assistance, or even foreign assistance to other countries in general?
I think the value of helping us, our people, and helping others already been inherited in our, at least in medical education. Many of the young doctors, you see, they want to do overseas work. They go to Malawi. They don't go to the United States. They don't go to San Francisco, not to London. They want to go Malawi, for example. They want to start somewhere they can contribute. And they want to recover the barrier of being a doctor, being a health professional. So I think it's been quite successful. We didn't do it purposefully. But through this overseas experience, many of the young health professionals already see a new value for their career.
Another interesting system that Taiwan has is the so-called alternative military service. In other words, many medical students who are participate in this program to go to other countries to do their medical practices instead of join the military in Taiwan. Could you explain that to our viewers a little bit?
Well, I'm glad that you mentioned that. Actually, last few years, we already have seen some of the medical doctor graduate from the medical school. They're doing their service responsibility overseas and in many of the African countries. And we also see some doctors now in Pacific Island countries. And they are very willing to do it because they see it's a good opportunity to see how the real world is really. You know, Taiwan already very fully developed. And you don't see very difficult challenge in terms of the healthcare. I mean, always somewhere you can find good service. So they went overseas and they find a value, and they see there's a lot of need in developing country with assistance from health professions. So I think this cooperation exchange for these young fellows is to broaden their view and redefine their career, and I think that's a good success. It's a win-win situation for us.
In addition to going abroad to serve other countries and other peoples, are we also have programs inviting other people to come to Taiwan to have the trainings or all kinds of seminars and so on?
Okay, I think there was a systemic windows that there are many young fellows from other developing countries come to Taiwan for short period of training in the hospital, and also not only doctors but also pharmacists. We offer a traditional medicine training last year in Taiwan within the main medical schools, and there are many other countries pharmacists or advanced professors coming to Taiwan to learn alternative medicine. We have also seen senior nurses from many other countries come to Taiwan to learn how to use our advanced technology in their cases. So I think we are quite opening up the windows. Well, not only those people from developing countries, we also welcome those in developed countries. We receive a lot of doctors coming to Taiwan from Germany to France, to Canada to learn something new in Taiwan. I mean, like I said, there was no Superman in public health. Everyone always benefit from learning from each other. And I think that when Taiwan sharing this experience, we also learn from the others.
Yeah. The most challenges for Taiwan now is the interaction between Taiwan and China, because the number of people traveling back and forth between Taiwan and China is increasing. Also the goods, products, and so on. What's your ministry's strategies in terms of dealing with that kind of challenges resulting from the closer, more extensive, intensive exchanges between the two sides of Taiwan Strait?
Yeah. I think we are deeply concerned about our people traveling to China, stay there, working there, because we know they are faced with great challenges because the public health, the medical care system was very inadequate at this moment. And so Department of Health was very willing to offer our experience to health authority in China. We don't care about what kind of situation because our minister already invited the Minister of China to have a good dialogue, to talk, to share with our experience. We are very generous. I mean, we really bind to the idea that the health care is without borders. And we certainly offer such assistance to developing countries, around Asia and many other. We certainly will be willing to develop assistance program to China.
Yeah.
Unfortunately, there was no positive, receptive situation from China yet. Well, I know we are trying to be patient. We are willing to wait. We are willing to do whatever we could to provide assistance, training for many of the doctors from China. Last year we offer 5,000. We hosting 5,000 doctors from China to many of the hospitals in Taiwan. We are very generous. We do whatever we could to help them because we believe that if China getting better in their public health, they're going to be better in their politics. They're going to move into democracy. It's going to be helpful for Taiwan.
Yeah. But China has been saying to everybody that our health, in Taiwan has been taken care of by China. China has been helping Taiwan and so on. Do you think that's an accurate statement?
Well, I think every time when China's delegate spoke that in WHO, it was only skin deep. People was only, look at that, come again. Well, unfortunately, I mean, it will take time for China to learn how to be a responsible citizen in a global community. Taiwan is not being accepted as a UN, but we were very proud of ourselves. We bind to global norms and positive side. Yeah. And China was always saying something and doing something totally differently. I hope that would change in the near future.
Coming back to the issue of Taiwan's approach to enter the WHO, will Taiwan continue to follow the strategy of this year's by applying for the full membership next year?
I think we're going to continue. I mean, there was a clear mandate, and we believe that our approach is right. Our get access to WHO is right. I mean, it's not only good for Taiwan, it's good for everyone else. So if you think that is right, we're going to go for that forever, until we will be accepted. Certainly, we would improve our strategy. We certainly would try to convince more of the others. Many people do not understand Taiwan is not a member of WHO. Many people would not believe Taiwan is still not a member of WHO. We need to get access to these people. These silent supporters are out there, and we need to provide an opportunity to show our willingness and their willingness.
Yeah, but look to the future. What are the prospects for Taiwan to enter the WHO in any foreseeable future?
I think we're going to work very hard, even harder. And we need to have a more partnership with many of the other members of the WHO. And we're going to be more transparent, more efficient to convey the message, because the message is not clear yet. Many people didn't get the real message, real fact about what's going on in Taiwan, what we are doing. So I think we're going to work harder and make friends, make partnership, and convey our message clear to the world.
Thank you very much, Dr. Chang. Thank you. Thanks for coming to our program.
Thank you.
Thank you
so much.
And that's Director General of the Bureau of International Cooperation, Ministry of Health, Dr. Peter Chang. Thank you very much. And see you next week.